Now let's talk about the introductions. Healthcare costs in Malaysia are rising due to demand, inflation, and new medical technology. But many young professionals remain underinsured because there are financial limits, lack of awareness, and the belief that insurance isn't necessary. This creates serious risks when unexpected illness or accident happens, leading to high medical bills, death, and even delayed treatment. Now, let's talk about the first issue. Healthcare costs in Malaysia have been rising steadily, mainly due to the medical inflation, which have jumped from 8 to 9% to as high as 15% in 2024. This really put pressures on both sides, which is hospital bills and insurance premiums. We want to compare public and private healthcare. The gap is very clear, which is the public hospitals are still remain affordable, but often overcrowded, while private hospitals are provided a faster services, but is still in a very high cost. For example, inpatient care in the government hospitals averages around 951 ringgit, while private hospitals can exceed until to 13,000 ringgit. Another issue is the hidden charge in the private hospitals. About 70% of a billable item are unregulated, so patients often faces unpredictable expenses. Insurance is supposed to provide protections, but premiums are still rising by 15 to 13% every year. This makes many young professionals are underinsured, relying only on the basic employer's coverage, which has left them financially exposed. The financial impact is serious because the medical bills can quickly deplete their saving, forces people to delay on their sales investments, weaken their retirement plans, and even push them into the debt through loan or credit card. Other financial goals like education funds and even emergency savings are also disrupted. Overall, young professionals are the most at risk with limited saving and insufficient insurance. They are especially vulnerable to the sudden medical bills that can create a long-term financial hardship.
Now, I will explain issue 2, which is underinsurance among working adults in Malaysia. This issue is very important because many people have insurance, but the coverage is not enough when they face serious medical issue. First, health insurance premiums in Malaysia have been rising very fast. According to the Star in 2025, premiums have spiked sharply and this makes insurance policies less affordable. As a result, many working adults are forced to downgrade to cheaper plans or even cancel their coverage. Second, many employees only depends on employer-provided insurance. However, these plans are usually very basic. For example, they have room and board limits, they exclude some treatments, and they cannot be used if the worker change jobs. Therefore, employees are left exposed when a serious illness happens. That the protection gap in Malaysia is very large. The Life Insurance Association of Malaysia in 2023 reported that the average family protection gap is worth hundreds of thousands of ringgit. This means many people think they are covered, but actually their coverage is far below what they really need. Finally, underinsurance leads to financial vulnerability. When unexpected medical bills come, workers have to use their savings, borrow money, or depends on credit cards. This disrupts their long-term financial planning, such as buying a house or saving for retirement. As we can see from this figure, medical cost inflation in Malaysia has always been higher than general inflation from 2019 and to 2024. This shows why many insurance plans quickly become outdated, leaving working adults underinsured. This situation makes many Malaysians financially vulnerable. With that, I will now pass to the next speaker who will explain issue 3. Thank you.
Third issue is about young professionals facing financial hardship due to unexpected medical bills. According to Zan & Son 2023, student loan debt plays a major role in financial struggles. In fact, 50% of young adults with late loan payment reported unpaid medical costs and more than half skip medication, tests, or doctor visits. This shows how debt repayment reduces access to healthcare. Barrett 2023 also explains that unexpected health events like accidents or serious illness create high medical bills and cause emotional stress such as anxiety and reduced quality of life. Many young professionals lack proper insurance or emergency savings, make them even more vulnerable. In short, there are threats between paying their debt or taking of their health. According to Zan & Son 2023, the bar chart showed that only 27% of people without loan reported unpaid medical bills, but this rise to 43% among loan borrowers, and it's become even worse at 50% for those with the late loan payments. This clearly shows how debt increases financial vulnerability. Despite this challenge, there are also opportunities to improve financial resilience. Research show that young adults with emergency savings had a 30 to 35% lower chance of skipping healthcare or having unpaid bills. However, only 45% of young adults have at least 3 months of savings. This highlights the need for greater financial literacy, awareness programs, and workplace training to encourage saving habits. By focusing on better debt management, affordable insurance, and emergency savings, young professionals can protect themselves against medical debt. At the same time, policymakers, employers, and financial planners must also work together to provide better support system.
Next, I will present the impact assessment. One of the impact of this assessment is rising healthcare costs. In Malaysia, healthcare costs keep increasing because of medical inflation and hidden charge. Many young professionals cannot afford private hospital, so they use card or loans to pay bills. This cause more debt and reduce more money for saving or investment. In the long term, it weakens retirement planning and financial stability. Next impact is underinsurance problem. Many workers have insurance, but the coverage is too small to really protect them. The protection gap can be hundreds of thousands ringgit. Insurance policies are complicated and many people don't fully understand what is covered. When a health crisis happens, families are forced to use saving or borrow money. This increases cause stress, reduce productivity, and makes households financially unstable. The third impact of this assessment is young professional faces financial hardship. Young adults face a tough choice like they have to pay student loans and pay medical bills, and sometimes they end up not pay the medical bills or skip treatment because most of them don't have emergency savings, so they become more vulnerable. On top of the financial strain, they also suffer emotionally like with stress, anxiety, and lower quality of life. Next, one of the recommendations is policy and government. The government should provide affordable and flexible insurance plans for young professionals. For example, starter plans with basic coverage at low cost. Hospitals must also be transparent with bills so people don't face hidden charges. The second recommendation is employers. Employers should offer medical coverage that employees can keep even when changing jobs. They also should give financial wellness programs like workshop on debt management and emergency savings. This reduces stress and improve employee financial health. Next recommendation is financial institution and insurance. Insurance companies should create more flexible and customizable plans. Micro insurance like small low-cost plans can help reduce the protection gap. Bank and fintech can also encourage people to save automatically, make it easier to build the emergency fund. The fourth recommendation is individuals, especially for young professionals. Young people should save at least 3 to 6 months of living expenses as an emergency fund. Review and upgrade insurance regularly to avoid being underinsured. It helps balance between paying off loans and spending on healthcare. Lastly, financial planners should include healthcare costs when helping clients plan for their future. They can use tools like scenario analysis to show how medical emergency affects savings and retirement goals. They should also recommend affordable insurance and help with debt restructuring to free up money for healthcare.
So, in conclusions, rising healthcare costs and underinsurance put young professionals in high financial risk. Many lack proper coverage and emergency savings, making them vulnerable to debt and unstable finances. To solve this, we need to better financial planning, affordable insurance, products a stronger financial literacy, and supportive policy with a combined effort from the government. Financial providers, employers, and individuals, we can protect the financial stability and well-being of Malaysia's young professionals.